I can get you to understand what I understand from it so you can remember. You have the ear, right? You have the auricle or the pinna, which is the earlobe. Then you have the external auditory canal. Then you're going to have the eardrum, okay? And so from the pinna to the eardrum, and this is known as the pinna or the auricle, which is the earlobe, down to the tympanic membrane. Okay, that's considered the outer ear, the external ear. All right. Then you have, I'm gonna draw this in a different color, green. You have a cavity, and this cavity is the middle ear. There's a little connection between the middle ear and the throat, which is known as this right here is known as the eustachian tube. Okay, and again, that's connected to the throat. Inside the middle ear, you have these bones that we call ossicles. Whoops, I want to write it out in black. They're called ossicles, and they're really small bones. They're the smallest bones in our body, and they're attached to the tympanic membrane, and they kind of look like this. Okay, and those three bones are known as the malleus. No, that's, I'm not sure that's how you spell it, but anyway, the incus and the stapes or stapes. Those are the three bones that you have inside the middle ear, okay?
Okay.
And they are responsible for conducting vibrations, and I'll explain that in more detail in just a bit. And then you have the inner ear, and I'm gonna draw the inner ear in red. The inner ear kind of looks like this. It has these two things that look like semicircular canals, and that's what they're called, by the way. You have the vestibule, and then you have the cochlea. It looks like a snail. That part is known as the inner ear, that red part right there, right? And you should know that these semicircular canals are these little, they're these tubes, and they have hollow openings inside, and there's fluid inside. That's important for you to know. So there's all this fluid inside, okay? And you have fluid in here, you have fluid all over here, okay? And then inside, of course, you also have these little yellow things that are the nerve fibers. Okay, they're all over the place. And then you have those nerves that are extending this way. And that's known as the vestibulocochlear nerve. Okay, so you have those three segments of the ear. It's broken up into three segments, into the outer, this portion, the middle, okay, including the eustachian tube, and the inner ear. We good?
Yes.
Meniere's disease develops or occurs when you have an excessive amount of fluid. You have too much fluid inside this area. And there's a problem because that fluid, as it moves around, it communicates with our nerve fibers, with the hair of nerves, and that allows electrical impulses to be created that travel through the vestibulocochlear nerve into the temporal lobe of the brain, so you can hear what I'm saying right now. That's usually how it works. Okay, when it comes to sound waves, this is how it works. You know, the sound waves come this way, they go in here, they hit the eardrum. When they hit the eardrum vibrates, and it causes these little bones to also vibrate. Does that make sense?
Yes.
And as those bones vibrate, they're connected to the inner ear, to that vestibule, which I'll discuss in just a bit. And it's connected to this area known as the oval window. Now, the name of this stuff, you don't really have to know too much. I'm trying to give you more so you understand the whole idea that the sound waves come in, they hit the eardrum. You have those three little bones that are vibrating, and the stapes is connected to an opening right here known as the oval window. And as the ossicles shake, they also cause the fluid inside to receive those vibrations. Does that make sense?
Yes.
And as the fluid feels the vibrations, they also communicate with the nerves that also feel the vibrations. And eventually that sends an electrical impulse that essentially communicates with our brain so we can hear everything. Normally, that's how normal sound conduction and nerve conduction occur. When you have Meniere's disease, you have way too much of that fluid inside. You have too much of that endolymph. Okay, there's two fluids. There's endolymph and there's perilymph. Okay, there's way too much of it, and that creates a problem because if there's too much of this fluid, then the nerve conductions are not going to be occurring adequately. Does that make sense? It's going to start interrupting that it communicates normally. And because your inner ear, which I should have mentioned, is responsible for balance. Whoops. Your inner ear is responsible for balance, aside from hearing. But that fluid inside, as it moves around, it communicates with your brain so your brain can understand where your body is positioned in space. That is called proprioception. So have you ever, let's say, stood in one place and spun around in circles?
Yes.
How do you feel after that?
Dizzy.
Very dizzy. So don't you feel like the room is spinning? So like if your head's right here, and when you do that, it feels like the whole room is spinning, right?
Yes.
And cartoons, they always draw these little stars up because that's kind of like, you're kind of like in La La Land. Well, the reason why you feel that is because that fluid in here, it's being shaken violently and it's communicating with the nerve fibers, but in a very unfavorable way. It's communicating with all these nerves, but it's not sending the normal signal that it's supposed to send. So it manifests as if the room is spinning, and we call that vertigo. The sensation that the room is spinning. Does that make sense?
Yes.
And when the room is spinning, you can't ambulate, you're at risk for falls and things like that. So when you have Meniere's disease, that's what you have to understand. You have an excessive amount of that fluid, which does not allow for proper communication, and your sense of balance and proprioception becomes affected. So you don't know necessarily where you're standing, if you're standing upright or to the side. And that's what causes the sensation that the room is spinning, because your brain can't detect that. Does that make sense?
Yes.
We have different ways of intervening in this condition. And remember, when it comes to interventions, we start with the least restrictive or least invasive. So before we start giving medications, you want to treat the vertigo. Okay, you treat the vertigo by having the patient lay flat, and you want to no noise and no movement, no light. That's the first thing you want to do to treat vertigo, because that's going to be the main thing that is going to be happening. You have to treat the vertigo because that's going to cause the patient to have an injury. Now, understanding that this condition is excessive fluid, you want to, your sodium in the diet, you're going to decrease it. Okay. When it comes to medications, we give mannitol, which is an osmotic diuretic that excretes excessive fluid from the body that is reserved for the cephalic region. So the fluid that's supposed to go to the head, including that become the endo and perilymph, well, we're getting rid of it. And that's how that fluid stays in low concentration, at least for the time being. Does that make sense?
Yes.
At the same time, we have these other surgical procedures. And sometimes we place a little device in here that's created a hole and a little catheter that comes out. And essentially, we excrete that fluid. Does that make sense?
Yeah.
Okay. These little catheters that we put inside to relieve the fluid, to relieve the pressure, because anytime that pressure increases, that's what's going to cause a vertigo. And so because the patient is going to have those signs and symptoms, we give medications like Dramamine. Okay, and that's anti-nausea medication because it's going to be decreasing the electrical impulse of the inner ear, which is going to hopefully decrease the likelihood of all that weird firing off of electrical impulses because of the excessive water in there, and it's going to reduce the vertigo. Is that clear?
Okay.
Okay.
Yes.
Any questions on that so far?
No.
Okay, that's Meniere's disease. Oh, I'm sorry. Was it okay for me to clear this out?